space. Intercostal spaces are simply spaces that tend to lie between ribs. They tend to span the entire length of the thoracic cage. They are found on the anterior and posterior aspect of the thoracic cage, anterolaterally and posterolaterally. We have a total of 9 intercostal spaces anteriorly, so we have 9 anterior intercostal spaces, and then we have at the back 11 intercostal spaces in total. The reason for this is because of the presence of the floating rib we talked about in the thoracic cage. Remember that we have two floating ribs present within the thoracic cage, ribs 11 and ribs 12, and these ribs do not extend anteriorly, they don't connect to the sternum anteriorly, and as a result, we tend to call them floating ribs. So, because they don't extend anteriorly, they don't form part of the anterior intercostal space, they just tend to lie posteriorly and form the or complete the intercostal space posteriorly to form a total of 11. What are the boundaries of the intercostal space? A typical intercostal space would have structures bounding it superiorly, inferiorly, anteriorly, and then posteriorly. Superiorly would be the superior inferior border of, or the sharp inferior border of the ribs above. So if you look at this picture, this is one intercostal space here. The structure bounding it superiorly will be this sharp border of the the ribs above it. So the sharp border of the ribs above it bounds it superiorly. What bounds it inferiorly is the smooth superior border of the ribs below it. If you look at this, you'll notice that the border below this intercostal space tends to be smooth and circular in shape. And then anterior medially and posterior medially. Anterior medially, the sternum tends to separate the intercostal spaces from one another on the right and the left side. And then posterior medially, we have the vertebrae separating the intercostal spaces from one another right to left. What are the contents of the intercostal space? Just like every other spaces within the body structure, we'll talk about the boundaries as well as the content. In terms of the content of the intercostal spaces, this include muscular structures and neurovascular structures. We have three major forms of muscles found in the intercostal spaces, and they are arranged from out to in as the external intercostal space, external intercostal muscles first, followed by the internal intercostal muscles, and then finally the innermost intercostal muscles. And each of those structures are clearly depicted in the image below. You could see the external intercostal muscle in front, followed by the internal intercostal muscle in the middle, and then finally the innermost intercostal muscle at the back. And then sandwiched between the internal intercostal muscle and the innermost intercostal muscle would be the neurovascular structures. Those structures are also well arranged. They are arranged from top to bottom as the intercostal veins, the intercostal arteries, and the intercostal nerves are shown in the image below. Let's dive in a little bit deep and talk about each of the contents of the intercostal spaces. Starting with the external intercostal muscle. The external intercostal muscle tends to be the most outward or the most outer muscle in as part of the content of the intercostal space. It has a very unique orientation to its fibers. The fibers of the external intercostal muscle tends to run inferior anteriorly, so they run from um, downwards facing towards the anterior aspect of the thoracic cage. So if you look at this, because how you can see how the fibers tend to run, they're pointing in this direction. And this is a better depiction of it. You can see that the fibers of the external intercostal muscles point downward and they point forward. And as a result, we tend to use the popular mnemonic hands in pockets to remember how the external intercostal muscles tend to run. Like, imagine you're putting your hand in your pocket, your hand will be going forward and going downwards and towards the anterior aspect uh, of your limbs. Then, in terms of one unique feature of the external intercostal muscle, the external intercostal muscle does not extend towards the um, does not completely fill the entire intercostal space. Now, this is very key to note. Both external and internal intercostal muscles don't completely fill the intercostal spaces that they tend to occupy. Usually, external intercostal muscles starts from the back, starts from the vertebrae, runs through all the intercostal space, but tend to end at the junction where the rib and the costal cartilage tend to meet. So this place where you have the junction between the rib and the costal cartilage is where the external intercostal muscles tend to end. If you look at this picture, you notice that the external intercostal muscles run through the entire intercostal space up until this point, up until this junction. So at this junction, where I'm outlining here, the external intercostal muscles tend to be replaced by a membrane. And the membrane that replaces the external intercostal muscle is known as the external intercostal membrane. And that's the membrane shown here. This aspect that is shown here, um, that is lighter than the muscle, is depicts the external intercostal membrane. The internal intercostal muscle is the second muscle as the content of the intercostal space. It is found in the middle portion of the entire space and tends to run inferior posteriorly, as um, in comparison or in contrast to the in contrast um, to the external intercostal muscle that we talked about. If you look at this picture, you should notice that the fibers of the internal intercostal muscles run they run inferiorly, they're running downwards, but they're running towards the back. They're going towards the back. So if another way in which you can think about is that they are running upward. I think this one is even better. So if you don't describe it as them running inferior posteriorly, as I depicted, you could also describe them as running superior anteriorly. So they're running and um, and towards the upwards and towards the middle or the anterior aspect of the body. So superior anteriorly will be another description. Usually superior anteriorly is best used if you want to use the acronym ANT in teeth, and that's contrast to what we talked about for the external intercostal muscle. Remember that for the external intercostal muscle, the acronym we used was ANT in pockets. So another counterpart to that or would be ant in teeth. Ant in teeth means you are putting your hands towards your breast side. So the hands will be running upward and towards the middle or the center of the body at where the breast is located. So that's ant in teeth. Or we could describe it as them running inferior posteriorly. Inferior posteriorly will just be them fibers orienting downwards but going towards the back. So just like the external intercostal muscle does not fill the entire space of the entire intercostal spaces, the internal intercostal muscle also doesn't fill the entire intercostal space. Usually, the internal intercostal muscle is unique because it begins from the sternum. So, external intercostal muscle begins from the vertebrae. The internal intercostal muscle tends to begin from the sternum at this point. So it begins from sternum, fills the spaces between the costal cartilages, then also extend into the spaces between the ribs, and then usually when we get to the angle of the rib, usually around this point is where the internal intercostal muscle tends to stop. So internal intercostal muscle runs through the part of the length or a large chunk of the length of the intercostal space. But once it gets to the angle of the rib, usually at that sharp bend of the rib, um, we have the internal intercostal muscles being replaced by a membrane. And the membrane that replaces the internal intercostal muscle is known as the internal intercostal membrane. It's not depicted in the image here. Just remember that for the external intercostal muscle, it tends to start from the vertebrae, runs or fills the entire length of the intercostal space up until the junction between the ribs and the costal cartilage, up until the part where you're having a space between each of the costal cartilages, and that's usually replaced by the external intercostal membrane. So just as we have the external intercostal muscle being replaced by the external intercostal membrane, we have the internal intercostal muscle being also replaced by the internal intercostal membrane. The last muscle in the group of content of our intercostal spaces would be the innermost intercostal muscle. Now, this is a combination of three different muscles found at different points that tends to fill the space behind the internal intercostal muscle. So, these muscles include the transversus thoracic muscle, the innermost intercostal muscle, and the costalis muscle. So, all these muscles together gives rise to the innermost intercostal muscle. Neurovascular structures found within the intercostal spaces, as said before, includes the intercostal veins, intercostal artery, and intercostal nerve. And each of these different structures are arranged in that unique fashion. They are arranged from superior to inferior veins, arteries, and the nerves. You hear them say, use the popular acronym VAN to describe the neurovascular structures in the intercostal space. And this is just one way to remember how they are arranged alongside knowing the structures that are actually found there.
The blood supply to the intercostal spaces and the entire thorax at large, starting with the arterial supply. So, in terms of the arterial supply to the thorax, most of the arteries and veins that tend to supply or drain the thorax would be found at that subcostal groove that we described in the previous model under the bones of the thoracic cage. So the subcostal groove tends to house the three major structures or three major contents of the intercostal spaces: the intercostal veins, the intercostal artery, and the intercostal nerve. So as a result, when we're talking about the arteries, it's important to know that the arteries tend to run across that or along that intercostal groove alongside the veins and the nerves. And this is a picture that clearly depicts that. You see in the picture below, the intercostal arteries are running just by the side of the subcostal groove together with the veins and the nerves. We have two major arterial supply, or two major arteries, arterial system to the thorax. We have the anterior intercostal arteries, which tends to span the entire anterior intercostal species. And then we have the posterior intercostal arteries, which would span the posterior intercostal species. The reason why we have a distinction between the two is because remember that we have a total of 9 anterior intercostal species and a total of 11 posterior intercostal species. So, by virtue of the fact that we have 9 anterior intercostal species and 11 posterior intercostal species, the arteries would also differ in terms of number. So the anterior intercostal arteries will be 9 in number, and their origin also will be different from the posterior intercostal artery, which tends to be 11 in number and have very different source. So just like with the anterior intercostal artery, we have 9 pairs of anterior intercostal artery because we have 9 anterior intercostal species. These 9 anterior intercostal arteries are paired, meaning we have 9 on the right side and 9 on the left side. And besides this, they tend to originate from different structures or different sources. So out of those 9 anterior intercostal arteries, the first six or the upper six arteries originate from the internal thoracic artery. So if we count the first six anterior intercostal species, the arteries that are found there are coming directly from the internal thoracic artery. This is the internal thoracic artery, yeah. So this internal thoracic artery gives rise to 6 out of 9 anterior intercostal arteries. The remaining three anterior intercostal arteries tend to be gotten from a different source. Usually, the source that gives rise to the lower three anterior intercostal arteries is the musculophrenic artery. So the musculophrenic artery gives rise to the lower three anterior intercostal artery, whereas the internal thoracic artery gives rise to the upper six anterior intercostal artery. Posterior intercostal artery are 11 in number because we have uh, 11 posterior intercostal spaces. Now, in terms of how they tend to originate, it also differs in contrast to the anterior intercostal artery and also in contrast to one another. So, what do I mean by that? So, the first two branches of the 11 posterior intercostal arteries tend to originate from the superior intercostal artery, and then the third to the 11th arteries originate directly from the aorta, and this tends to be the difference between each of the individual posterior intercostal arteries. The venous drainage of the thorax also tends to mirror that of the arterial supply, in the sense that the veins of the thorax or the intercostal veins tend to also be located in the subcostal groove. Remember that they are arranged most as the most superior structure in the subcostal groove, followed by the arteries and followed by the nerves. And just like we had the anterior intercostal arteries being divided into two forms, just as we had the intercostal arteries rather being divided into two forms, anterior intercostal and posterior intercostal arteries, we also have the veins being divided into two forms. We have the anterior intercostal vein and the posterior intercostal vein. And because we have different numbers of the intercostal species, 9 anterior intercostal space, and then 11 posterior intercostal species, as a result, we also have different differences in the numberings for the anterior intercostal vein and the posterior intercostal veins. Anterior intercostal veins are 9 in number because we have 9 anterior intercostal species, and each of these veins tend to drain into different sources at the end of the day. So, in terms of the end or termination of the anterior intercostal veins, the first six out of the 9 anterior intercostal veins will drain into the internal thoracic vein, and then the remaining three veins out of the anterior intercostal vein, out of the 9 anterior intercostal vein, drains into the musculophrenic vein. So just a very similar or unique configuration as pertains to what we saw in the anterior intercostal arteries is practically what we see in the anterior intercostal vein. Major difference tends to be in the posterior intercostal vein. So the posterior intercostal vein, yes, 11 in numbers and a paired because we have 11 posterior intercostal species. But in terms of how they drain into uniquely different structures from the posterior intercostal arteries. So the posterior intercostal vein tend to drain into two structures. They drain into the ischius vein and the hemiischius vein. And in terms of how this drainage tends to occur, if you look at the picture below, it depicts for us how that tends um, to happen. So if you look on the, let's say on the right side, let's start with the right side. Let's say the right side of the thorax. On the right side of the thorax, you would notice that the um, drainage of the posterior intercostal veins from vein 1 to vein 11 tends to be different. So the first intercostal vein, for example, tends to drain directly into the superior vena cava. So you can see first intercostal and posterior intercostal vein draining directly into the superior vena cava. Sometimes we say it drains into the right brachiocephalic vein. So sometimes it will be the right brachiocephalic vein as shown here. Sometimes it could be directly into the vena cava. So that depends on what particularly was said in your slide. Then from the second to the fourth posterior intercostal vein on the right side. So this is just focus on the right side. All those veins will combine together to form a single vein, and then they drain into what we call the superior intercostal vein. So the second, the third, and the fourth posterior intercostal veins on the right side drains into the right superior intercostal vein. That will eventually enter into the ischius vein. So as shown here. So and then the sixth down to the 11th posterior intercostal vein on the right side, they all directly drain into the ischius vein. So all of these veins, sixth vein or the fifth vein rather, down to the 11th vein drains into the ischius vein. So just to recap, on the right side we have the first posterior intercostal vein on the right side draining into the um, right brachiocephalic or the right superior vena cava. The second, third, and fourth posterior intercostal vein on the right side drains into the right superior intercostal vein. And that will eventually end up into the ischius vein. And then from the fifth to the 11th vein, those veins will end up directly into the ischius vein. On the left side, this tends to be different. On the left side, we see the first intercostal vein on the left side draining directly into the left brachiocephalic vein. All right. Then the second, third, and fourth um, intercostal veins or posterior intercostal veins on the left side would also join together to form a left superior intercostal vein as shown here. So we have a right superior intercostal vein and a left superior intercostal vein, both of which are gotten from the drainage or tributaries coming from the second, third, and fourth posterior intercostal veins bilaterally. And then on the left side, the fifth intercostal vein or fifth posterior intercostal vein going down to the eighth posterior intercostal vein. All these veins together will drain into what we call the accessory hemiazygos vein. So the fifth to eighth posterior intercostal vein on the left side drains into the accessory hemiazygos vein. And then this accessory hemiazygos vein will run all the way to the other side, to the right side, to drain into the ischius vein. Then finally, the ninth all the way down to the 11th posterior intercostal vein on the left side will drain into the hemiazygos vein. So there are four major sources of veins on the left side, whereas there are three major sources of vein drainage on the right side. For the left side, the four major sources includes the left brachiocephalic vein, the left superior intercostal vein, the accessory hemiazygos vein, and the hemiazygos vein. And each of them have different branches of the posterior intercostal vein draining to them. The left brachiocephalic is just the first branch. The left superior intercostal vein is the second to the fourth branch. The fifth to the eighth posterior intercostal vein, it's the accessory hemiazygos vein they drain into. And then the hemiazygos vein tends to receive the ninth to the 11th posterior intercostal vein. So on the right side is a different thing. We just have three: superior intercostal, superior vena cava, or sometimes the right brachiocephalic vein, the right superior intercostal vein, and then the azygos vein. Let's talk about the nerve supply to the thoracic cage, the nerve supply to the thorax. Just like we had the arteries and the veins tending to run on the subcostal groove, we also have the nerves running on the subcostal groove. And in terms of the nerves or the intercostal nerves tend to all originate from the anterior rami of the spinal nerves from T1 all the way down to T11. So we have a total of 11 intercostal nerves, 11 intercostal nerves. Out of these 11 intercostal nerves, we tend to classify them as either typical nerves or atypical nerve. Remember that when we're talking about the thoracic cage, we classified ribs as either being typical or atypical. We also classified vertebrae as being either typical or atypical, as well as the nerves. We also have nerve classification into typical nerves and atypical nerves. Typical intercostal nerves includes nerve 3 down to nerve 11, and then the atypical nerve just includes the first and the second um, intercostal nerve. So how do we distinguish between atypical and an atypical from an atypical nerve? Typical nerves generally tend to have a cutaneous branch and a lateral branch. So they have cutaneous branches. So branches that will come from, let's say this is the main nerve here, running from the back all the way to the front along the subcostal groove together with the intercostal veins and artery. A typical intercostal nerve would have a lateral branch that pops out at the angle of the rib. And it will also have an anterior branch that pops out towards the termination point of that nerve, very close to the sternum. So the cervical nerve possesses cutaneous anterior branches and cutaneous lateral branches to the skin of the thorax. Aside this, a typical intercostal nerve would also have collateral branches to muscles. So muscles around the nerve are supplied by the nerve and usually tends to be supplied by what we call collateral branches. And then finally, a typical intercostal nerve possesses what we call visceral branches, and the visceral branches tend to supply pleural and peritoneal membranes surrounding that particular area. So pleural membrane, the chest, peritoneal membrane is usually lower down, very close to the abdomen. The two atypical nerves include the first and second intercostal nerve. What tends to distinguish them from the typical nerves tend to be unique features that we don't see in the other ones. So the first intercostal nerve, for example, is unique because it tends to join the cervical nerves, or that's from nerve 8, the 8th cervical nerve all the way up to the 5th cervical nerve. It tends to join these nerves to form the brachial plexus. So it is not necessarily involved in the nerve supply to the thorax. It's largely involved in nerve supply to the upper limb because of the fact that it joins the lower cervical nerves to form the brachial plexus. Remember that brachial plexus is gotten from the anterior MI of C5 down to T1. So that T1 serves as the first intercostal nerve rather. And as a result of that, makes it not unique in its ability to supply the thorax, just like the other ones. Aside this, the first intercostal nerve, because it is supplying the brachial plexus, usually has no anterior cutaneous branch supplying the thorax. It doesn't give rise to anterior cutaneous branch that will supply the anterior part of the skin of the thorax. The second intercostal nerve is unique and atypical because of some very important differences. For example, the second intercostal nerve tends to join the intercostobrachial nerve, and it tends to form a unique nerve that supplies the arm called the medial cutaneous nerve of the arm. So this medial cutaneous nerve of the arm, if you notice, is also a branch of the brachial plexus. So it's a branch of the brachial plexus that is joined by the second intercostal nerve, forming what we call the intercostobrachial nerve as a result. And this particular unique combination, intercostobrachial nerve together with the second intercostal nerve forming the medial cutaneous nerve of the arm, would supply the skin of the axilla and supply the medial side of the arm. So it's not involved in supplying the chunk of the thorax where it tends to lie because of that's uniqueness. The unique aspect of it joining the intercostobrachial nerve and forming the medial cutaneous nerve of the arm. Let's talk about lymphatic drainage. Lymphatic drainage of the thorax tends to be unique because of its the amount of numerous lymph nodes we see distributed across the entire thorax. So different aspects of the thorax has different forms of lymph nodes that tend to drain it. For example, the anterior chest of the thorax is drained by the anterior axillary nodes. The posterior chest of the thorax is drained by the posterior axillary nodes. And then when we talk about the intercostal spaces specifically, the anterior intercostal spaces, 9 of them are drained by the internal thoracic nodes. Right, these are nodes that are found around this area. So the internal thoracic nodes, speed here. And then the posterior intercostal spaces would be drained by the para-aortic nodes, nodes found very close to the aorta. So these are the para-aortic nodes around this region. So posterior intercostal spaces drained by para-aortic nodes, anterior intercostal spaces drained by the internal thoracic nodes. And then in terms of the chest wall themselves, those ones are drained by the axillary nodes anteriorly and posteriorly respectively. That concludes our module on the intercostal space.